To better meet evolving healthcare needs, Catholic Health's Good Samaritan Hospital is building a Patient Care Pavilion. This facility will be located on the northeast portion of the campus and feature a state-of-the-art 75-bay emergency department, 16 high-tech operating rooms, and 3 floors of private patient rooms. The facility will add more private spaces for patients, and enhanced clinical service areas will offer increased patient satisfaction and a pleasing patient experience. Welcome to Catholic Health Stronger Together with Dr. Dave. To talk more about the Patient Care Pavilion at Good Samaritan Hospital is Joe Loiacono, Good Samaritan Senior Vice President of Planning and Development. Welcome, Joe, and thank you for joining us today.
We're very proud of this project at Good Samaritan Hospital, and it's going to be a pleasure.
What shaped the decision to move from the idea of a patient pavilion to actually start building one?
We've been planning this in earnest since 2017. Good Samaritan has not had a major modernization project since the 1980s. The hospital was built in 1959, and the facility was in real sorely needed for an upgrade. We conducted a capacity and utilization study with an outside consultant and our own physicians and nurses and staff and administrators, and determined tried to project what the needs were for the community and for Catholic Health Services based on trends and utilization of healthcare for 10 years and beyond. What we came up with was a need for emergency care, surgical procedures, a modernized surgical facility, and private patient rooms to enhance the patient's experience at the hospital. Once we determined what the need was, we worked with the community to get their ideas and input as to what they felt the need for healthcare in their community was. We had many meetings with different community groups, private citizens, private residences, government officials, local community organizations, took all of that input in, and then began to develop the pavilion and the project.
You took the input from so many different areas to make sure that everybody's needs were being met.
That's right.
And that it would be appropriate for where it is in the community. So
that's right. Good Samaritan is located in a residential area. It's on Montauk Highway, but we're bordered by residences on both the east and the west side. So it was very important for us to respect the life, the quality of life of the folks that live, and particularly the folks that border the hospital. So we took a lot of input from them and what their needs were and what their ideas were for a quality healthcare system.
That's excellent. So a Patient Care Pavilion is a fitting name for this project. What are some of the key ways you'll be enhancing the patient care experience?
Well, starting from the ground up, the new state-of-the-art emergency room is actually going to be relocated from its current location at the south end of the campus up towards closer to Montauk Highway. What happens with that is we improve the access to the facility from Montauk Highway, eliminate the need for patients to travel all the way to the south of the campus through a residential neighborhood to seek the emergency care. The emergency room is located in close proximity to the other critical services of the hospital, immediately below the surgical pavilion. We will offer all private treatment rooms, as opposed to a typical emergency room where patients are located in, right next to one another, separated by only a curtain. These are hard-sided rooms with sliding glass doors. The operating rooms are sized appropriately for complex surgical procedures. There are 16 operating rooms. 8 of them are oversized for specialty procedures in cardiology, neurology, vascular surgery, things like that. Will include 2 hybrid operating rooms. A hybrid operating room is an advanced operating room with imaging equipment in the room so that the surgeon and the surgical team can actually see advanced images of the body and the surgical site.
What you're doing is you're creating a state-of-the-art facility basically in everybody's backyard on the South Shore of Long Island.
That is right. That is true. The top floors, as you mentioned, will be all private rooms. There's 105 new private patient rooms.
Wow.
It's important to note that we're not increasing the bed count in the hospital. What we are doing is we're separating, because our studies showed that there is a trend toward toward outpatient care and reduced hospital lengths of stay. So these private rooms will enable us to separate existing private shared patient rooms and then create private rooms. Each room is equipped with a private shower, private bathroom, and accommodations for a loved one, like a husband, a wife, a parent, to stay with the patient when necessary.
So again, it's very patient-centric. So you're telling me the new emergency room is not just going to have curtains, it's actually going to be separated by some type of physical barrier?
Well, they're all hard-sided private rooms.
Amazing.
Right? 75 hard-sided private rooms. Furthermore, the emergency room is sectioned as to separate area to treat pediatrics, separate area for trauma. I'll call them routine emergency visits for adult patients, and also a special area that can be isolated for patients with behavioral health issues. So we'll have separate areas in the emergency room and different pods where the staff can treat patients with different needs.
That's impressive. So very well thought out. And so let's go upstairs from the emergency room and let's talk about the patient rooms in a little bit more detail. Tell me more about what is some of the attention to detail that was put into creating these patient rooms?
Well, we learned a lot of lessons from the pandemic. For example, each patient room is equipped with a what I'll call a server, so we can restock the patient room without going into the patient room, which was important during the pandemic where the patient had to stay on isolation. So we can actually restock and materials, gowns, medical supplies and things like that, linens from outside in the hallway into the patient room if we're treating a patient that requires isolation. So the nurse can stay in the room and receive supplies from outside the room. We have the floors on the patient units. Actually, the floors throughout are no wax floors, so we can limit the use of certain caustic cleaning materials that sometimes can be bothersome to some people, and some of the actually all of the materials, paint, fabrics on furniture, even some wall coverings are antimicrobial wall coverings or antimicrobial materials that'll help reduce infection and the private patient rooms in and of themselves promote healing, a restful environment, and actually reduce cross-contamination from one patient to another.
Finally, we are thinking about the patient and feeling comfortable in their own area, their space, and that they can actually have peace and continue to heal.
We have accommodations, with 2 people in a room. If the patient needs a companion, for whatever reason, now you've got 2 patients, now you've got 4 people in the room. There's simply no room for a caregiver and 4 people. So with the private room, there's a pull-out chair, sleeping accommodations, a private shower, and workspace for the nurse, workspace for the patient. You know, it's going to be a vast improvement in the patient's experience in the private rooms. Another thing that's important was working with the community. We actually, the first floor of the building is the emergency room. The second floor of the building is the operating rooms. The fourth, fifth, and sixth floors are the private patient rooms. The third floor is what we call an interstitial floor, where all the mechanical equipment is located. This not only helps control the cost of the construction, because you're not running you know, ducts and pipe work all the way from the roof to the ground floor. But importantly, there's nothing on the roof, so the building fits in with the environment a lot better than if you've got the duct work and the air conditioning, air handlers, and everything else on the roof, which was a big plus for the community to construct a building that is pleasing to the eye.
Well, it's a beautiful community. So people watching this show who aren't from Long Island, we're right on the water. So it's the community is an absolutely gorgeous community, very family oriented. So I think that's great that that was taken into consideration.
That's right. Part of the room that's basically towards the window, that's because when you first walk into the room is the patient, so that the nurse or the caregiver, the doctor, can access the patient easily. And then beyond the patient is sort of the companion area where the bathroom and shower are, and the furnishings for the companion, which will, you know, the private patient rooms are sized typically to pretty much the same size as a shared patient room now, so there's a lot more space there.
Yeah. When is this project going to be completed?
We've already started. We started by transforming the campus, right? We had to build some new parking lots and improve the roadways to access the campus and the parking lots. We worked with the Department of Health, the Department of Transportation, the local, we call them authorities having jurisdiction. Been very, very helpful, and they've also embraced this project. The duration of construction is approximately 33 months. Doing the math, that opens that we plan to open the building around the first quarter of 2025. I'd also like to give a shout out to our staff. You know, during the planning, we conducted a series of what we called immersive design events with groups of staff up to 30 or 40 people from the emergency room, the operating room, all levels of staff, from the lead physicians through nursing staff, other support staff, and took input from everybody. So everyone had input on this project. So we're very excited about that, and very excited to bring it to fruition.
And I think you and your team deserve a tremendous amount of credit. I think the community is going to be much better for it, and it's in line with Catholic Health, very patient-centric. So kudos to you. And thank you so much for joining us today. When we come back, we will hear more about the clinical focus of the Patient Care Pavilion. Stay tuned.
Are you ready to open your heart and home for 18 months to a puppy like Esther? To find out more about becoming a canine companion for Independence Puppy Raiser, visit cci.org or call 1-800-572-BARK. You can make a world of difference in the life of a person with a disability.
14-year-old Hirabai lives in a rural village in India and dreams of attending college one day. But an exhausting and dangerous walk to school makes attendance difficult and leaves her little time to focus on her studies. For girls who don't graduate, the risk of forced early marriages and exploitive child labor are greatly increased. Today, through Child Fund International's Dream Bike program, thousands of girls in 11 countries are provided bicycles that enable them to make their daily trek in a safe and timely manner. This allows them to get home before nightfall and affords the girls precious time for their homework. Increased attendance and more free time means girls like Hirabai have a greater chance of success. Hirabai's Dream Bike is much more than just a bicycle. It's a way for her and girls like her to get an education, break the cycle of poverty, and attain their dream of a better life. Child Fund, providing safe passage to a better future. Learn more at childfund.org.
You deserve to disconnect. Take back your drive. Visit distracteddriving.nsc.org.
Welcome to Catholic Health Stronger Together with Dr. Dave. Good Samaritan Hospital's emergency department is often the first point of contact for both adults and children seeking health care in Suffolk County. The emergency department staff treats nearly 80,000 patients a year, which is the second highest amount in the county and the most on the South Shore of Long Island. With such a high demand for emergency services, Good Samaritan's surrounding community and our healthcare professionals deserve the best medical experience possible. Here's Good Samaritan's Chair of Emergency Medicine, Dr. Chris Rayo, with more on how this project will enhance the emergency department.
Hi, my name is Chris Rayo. I'm Chairman of Emergency Medicine at Good Samaritan Hospital and also Chief of Emergency Medicine at Catholic Health. We're very excited to talk to you all about our new planned Patient Care Pavilion. A big piece of that construction will be a brand new emergency department. We're not really planning for more patients to be seen, as we treat nearly 90,000 patients annually, but we are planning on caring for those patients in a much more modern, efficient environment. We really look at the emergency department as a resource for our community and also as the front door to our adult and pediatric ACS verified trauma center, our comprehensive stroke center, our cardiac center, and really the front door to all of the clinical programs here at Good Samaritan. This new Patient Care Pavilion will enable us to recruit top-notch physicians. It will enable us to treat our patients more efficiently in designated adult, pediatric, behavioral health, and critical care areas designed really especially for those patient populations. It will place the emergency department in very close proximity to other critical services such as the operating room, interventional suites, to get our patients from point A to point B much more rapidly and much more efficiently. We're really very excited, the physician staff, nursing staff, ancillary staff here, we're very excited about this new Patient Care Pavilion because we really think it will enable us to deliver the care that our patients and their families deserve.
That's great news for the talented emergency and trauma teams working at Good Samaritan, as well as the communities they serve. In addition to the emergency department, Good Samaritan is also enhancing its surgical capabilities with additional operating rooms and private patient rooms. Good Samaritan's director of the Stroke and Brain Aneurysm Center, Dr. Kimon Bekelis, offers an inside look at this new space.
As part of the new Patient Care Pavilion that we're building in Good Samaritan Hospital, we'll be integrating 16 new operating rooms, which will also involve 2 hybrid operating rooms. These operating rooms are going to be state-of-the-art with tremendous technology that will allow us to be able to access the most remote places in somebody's body without having to do extensive surgery. This is the future of healthcare, and it's happening right here, right now, in the South Shore of Long Island. Our hybrid operating rooms allow us to be able to offer procedures to the patients that were never able to be offered before. For example, in neurosurgery, we often need multiple different teams to take care of the patient. Those involve monitoring teams where we monitor the brain activity of the patient, and that involves a technologist and a neurologist. It involves frequently other monitoring teams for the spinal function of the patient if we're doing a complex spinal procedure. It involves the scrub nurses, the scrub techs, a lot of the implants that we're using, even anesthesia and other ancillary personnel that allow us to do these procedures. Now on the hybrid side, we're able to have not only the capabilities to do open surgical procedures, but we also have the capabilities to harness the power of imaging technology to be able to look into the patient's body through small holes in their arteries so that we can get to where we need to go in a minimally invasive way. That again is very important for neurosurgery and endovascular neurosurgery when we're trying to remove clots from very remote parts of the body, or when we're trying to treat brain aneurysms without opening somebody's head. Again, these are procedures that are only able to be done through hybrid rooms, and that expansion will allow us to be able to do these procedures and expand into the future. Right now, we're looking into expanding the size of the operating rooms into about 800 square feet and higher That will allow new technology to be brought in, imaging technology, X-ray technology, CAT scan, MRIs, more monitoring equipment for the patients. And as I said, we'll bring the hospital and our community to the future of healthcare.
We have to take a break, but when we come back, we will hear more about the benefits from a community perspective.
Discover immunotherapy and find out how your body's natural immune system can become your greatest hope in the fight against cancer. Speak with your doctor and visit su2c.org/immunotherapy to learn more.
Food. It nourishes, brings us together, and adds flavor to life. That's why it's important to wash hands, surfaces, and fresh produce. Keep raw meat, poultry, and seafood separate from ready-to-eat foods like fruits and vegetables. And cook to proper temperatures using a food thermometer. Enjoy! And refrigerate leftovers within 2 hours. For more tips on safely preparing foods, visit homefoodsafety.org.
You're looking at the #1 cause of lung cancer. That's why the Surgeon General issued this warning. Now you're looking at the #1 cause of lung cancer for non-smokers. That's why the Surgeon General issued this warning. Radon is an invisible radioactive gas that seeps inside your home from underground. Whether you smoke or not, radon can cause lung cancer. Protect your family. Have your home tested. Call 1-800-SOS-RADON. Radon problems can be fixed.
Attention travelers. Next Tuesday, a major power outage will cause complete chaos throughout the city. Water, phone, and internet service will be in short supply. There will likely be panic citywide. Stand clear of the closing doors, please.
Disasters don't plan ahead. You can. Talk to your loved ones about how you're going to be ready in an emergency. Don't wait. Communicate.
Welcome to Catholic Health Stronger Together with Dr. Dave. Good Samaritan Hospital prides itself on offering the highest level of compassionate care to its West Islip neighbors and community all across the South Shore of Long Island. Many community members have received health treatment from Good Samaritan throughout their entire lives.
My earliest memories of Good Samaritan Hospital go back pretty far. I've lived in the Bayshore, Brightwaters, Islip area since I was 2 or 3 years old, and my family moved to the area in the late 1940s. My father, Dr. Joe Lambert, was an internist and cardiologist who, from the opening of the hospital in 1959 to 1984, I believe, spent 25 years as the director of internal medicine at Good Samaritan. And he did a stint in the mid-60s, a 2-year stint in the mid-60s as the president of the medical board. My own formal involvement with Good Samaritan dates back to 1976 when I was asked if I'd be willing to join the hospital's legal and bylaws committee, which I did. And I served on that committee for a number of years. And then in 1992, I became a member of the hospital's board of trustees and was privileged to be able to continue serving as a board member until 2014, with a stint, I believe, from 2003 to 2005 as the board chairman at Good Samaritan Hospital. I'm still involved currently with a number of boards and committees at Catholic Health, including the Catholic Health Planning Committee, which had a central role in the planning and approval process for the new pavilion at Good Samaritan. All 12 of my children, 11 of whom have survived, were born at Good Samaritan, as were 14 of my 23 grandchildren. My wife, Janet, when she was a teenager, served as a volunteer. They called them Samaritans, I believe. She served in the hospital's radiology department as a teenager. One of our daughters works as a nurse in Good Samaritan's maternal fetal medicine department, and I have our youngest son also works at Catholic Health. So I'd say my involvement with Good Samaritan is a long one, and it's a very deep one. With the advances in medical technology, differences in patient expectations, and the more complex procedures being done at Good Samaritan, I think there was a crying need to have a more modern physical facility in order to be able to continue serving the patients in the community in the years and decades to come. I have a strong belief that everyone, and I mean everyone, is entitled to quality and compassionate health care. Caring for the sick is also a core mission of the Catholic Church, and it is for those basic reasons that I was willing to dedicate my time as a volunteer serving Good Samaritan Hospital for these many years. I think it's going to be an essential component of Good Samaritan's ability to continue serving the community of which I and most of the members of my family are a part for the next several decades.
The Patient Care Pavilion is expected to be complete in 2025, but that hasn't stopped any of the excitement surrounding this project. Leadership from Catholic Health and Good Samaritan recently joined with religious and community leaders to celebrate the start of construction with a groundbreaking event. Here are some of the sights and scenes from that big event.
I'm thrilled to invite up to the podium Miss Christine Newens, who is a former patient of ours and also of Dr. Kimon Bekelis. Ms. Newens.
With this addition, patients won't have to get that long hike from the ER. They will have easier access to better treatments and newer technologies.
What a great event. We're all looking forward to the completion of Good Samaritan's Patient Care Pavilion. For more health information, tune into Catholic Health, Stronger Together with Dr. Dave. If you would like to know more about Good Samaritan's Patient Care Pavilion or to make a gift in support of this or another program that is important to you, please visit chsli.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. Dave Degatti, and I hope to see you next time on Catholic Health, Stronger Together with Dr. Dave.